So mobile health, or mHealth, is really an evolving field. There's so much in terms of mobile health being used right now. And so mobile health includes smartphone applications, wearable devices, all kinds of things out there. And there are actually about half of the 3.4 billion users of smartphones have health-related applications. So that's a really high statistic, as you can imagine, of the number of people who have access to health-related apps. And so what we've tried to do is to leverage the increased use of smartphone technology to try to really increase access and have scalable, accessible forms of migraine treatments, specifically behavioral treatments. So just to provide some background, there are some level A, so top evidence-based behavioral treatments for migraine. They include cognitive behavioral therapy, biofeedback, and progressive muscle relaxation therapy. So what we just decided to do is we created this app that has both an electronic headache diary as well as progressive muscle relaxation therapy. And what's really exciting about it is that there's back-end analytics in the app to capture the amount of time spent playing the progressive muscle relaxation therapy. And so this way we can monitor the feasibility and acceptability, but really how frequently are patients and at what dose are they using the progressive muscle relaxation. So we've recruited over 400 patients from across NYU Medical Center. This is from settings ranging from neurology to primary care. We also studied it in patients with multiple sclerosis and migraine, as well as post-traumatic headache. So we wanted to see if patients are willing to use a smartphone app that has an electronic headache diary as well as the progressive muscle relaxation therapy. And so it's been really exciting analyzing the data. We found in a study of 51 patients with migraine that those who used the app actually had a pretty good reduction in headache days, and this is safe, effective treatment then. We don't have to worry about side effects to medications and other kinds of side effects. It was pretty safe. And so we also studied it in patients with post-traumatic headache. And this population is a little bit more challenging because they also have more cognitive issues related to the concussion and so forth. But it does seem that of those who use the progressive muscle relaxation in the app, they also had a reduction in their headache days. And so this is really exciting news that we presented at the American Academy of Neurology meeting. So one of the mainstays of headache treatment is the use of a diary. And so traditionally, patients were using a paper diary to mark down their headache days, the intensity, the frequency of the medications used. Physicians could then track the amount of abortive medications that are used, and you could also have them mark down when they increase the doses of the preventive medications to see if there's a benefit as you up-titrate the dose. And now there's been a movement more toward electronic headache diaries, and there's been the creation of a lot of different commercial smartphone applications that provide electronic headache diaries. And some of them also now allow people to track their triggers, allow them to track all kinds of things. There are also apps out there that don't have electronic headache diaries but purport to give treatments. And so they may have mindfulness-based treatments and other kinds of treatments, all different kinds of things. The thing about these apps is that the data behind them is somewhat lacking in some sense. Because the data is lacking in some sense, it can be a little bit hard for both patients and physicians to decide which apps to use. There can also be some concerns about privacy because people are putting in information about their headaches, for example. They're putting in information about the medications that they're taking, all kinds of things, their mood, so some of their psychiatric history, their sleep. And so patients sometimes need to inquire or wonder who's going to own the data. Is that data going to be shared with others? And I think it's, really interesting time and also raises a lot of questions. So if the employer is giving you an app, then is the employer owning the data that you're putting into the app? So if you're a pilot or you're a surgeon and you're tracking your sleep and you're having some difficulties with sleep and with insomnia and so forth, do you really want your employer to know that? Conversely, I think that there are a lot of advantages for tracking some of this. So a lot of our patients, people with migraine complain of fatigue, people with multiple sclerosis complain of fatigue, and concussion complain of fatigue, and so forth. And so I think that there's a lot of potential for tracking things like fatigue using a smartphone application, because that's a lot of data that can be analyzed to help better understand what is the meaning of fatigue and to try to do research studies and get to the bottom to help patients. However, it's really who's owning that data, and is the data actually getting to the clinician? Another thing about these apps is that A lot of the apps are created with the idea that the data is then going to get from the patient to the clinician. And a lot of the apps to date don't have that ability. They're not actually part of the electronic medical record system, and there's not a full cycle of the person inputting the data and then having the data analyzed and then getting it to the physician in a way that's understandable, meaningful, and also isn't just a dump of data that can lead to burnout for a physician.